Schizophrenia is a complex mental condition characterized by various symptoms that include delusions, hallucinations, social withdrawals, and disorganized thinking. Haney wrote that the global prevalence of schizophrenia varies, but it's estimated that the condition impacts 1% of adults, with rates in the United States starting from 0.6 to 1.9%. The causes of these conditions are still elusive to this day, with current evidence suggesting a complex interplay of neurological, environmental, and genetic factors. Genetic predispositions are especially evident in groups with family history, while environmental influences such as maternal malnutrition, toxin exposure during prenatal stages, or stress events can also contribute to the onset of schizophrenia. In addition, imbalances in neurotransmitters, especially dopamine and glutamate, are implicated in the root causes of schizophrenia pathopsychology. According to Haney, 3 symptoms are associated with schizophrenia, namely positive, negative, and cognitive symptoms. The positive symptoms include disorganized behavior and speech, paranoia, delusions, or false belief, and tactile, visual, or auditory hallucinations. Negative symptoms entail flattened affect, lack of motivation, and decreased speech and movement. Lastly, cognitive symptoms include impaired working memory, trouble concentrating, and poor executive function. Brasso identified multiple risk factors that lead to the emergence of schizophrenia, with some of the non-modifiable risk factors including genetic predisposition, age, onset often occurs in early adulthood or late adolescence. Another factor is sex. Men have higher likelihood of getting the condition than women. Modifiable risk factors include substance abuse and perinatal complications like infection or malnourishment in the mother. Childhood trauma, stressful life event, and urban upbringing also present higher risk in schizophrenia. The brain is the one that is most affected by the condition, resulting in the cognitive impairment. Shu states that there are consistent limitations in a host of cognitive domains, which include basic cognitions such as executive functioning, spatial functioning, memory, attention, and perception, while advanced cognition includes language, abstract thinking ability, attribution style, and emotional cognition. As a result, Patel describes that schizophrenia chronically disrupts emotions and thoughts, impeding social interaction and meaningful connections. The researcher states that positive symptoms such as hallucinations and delusions are noticeable, while negative symptoms, including low emotional expression and lack of initiative, create diagnostic challenges. On the other hand, cognitive symptoms that include disorganized thinking hinder communications. Patients suffering from the condition usually encounter substance abuse, depression, anxiety, and poor awareness of the situation, resulting in occupational and social impairment. Haney states that diagnosis of schizophrenia mainly depend on clinical evaluation entailing a comprehensive psychiatric history to identify signs such as delusions, hallucination, and disorganized thought processes. The researchers add the tools such as DSM-5 or ICD-10 offer guidelines for symptom identification and duration required for diagnosis. Laboratory and imaging are also important to rule out other possible causes of psychosis. Haney states that the tests are for thyroid function, electrolyte imbalance, blood glucose level, and urinary toxicology screen to establish substance abuse. The authors also state that imaging such as MRI and CT scans are used to examine neurological abnormalities. Additionally, risk assessments are important for evaluation the possible dangers of harm to self or others, which is important for enhancing the patient outcomes and quality of life. Westhoff identified that the prevention of schizophrenia entails early recognition and intervention because the duration of untreated psychosis significantly affects the condition course. Thus, the researchers assert that proactive approaches that combine neurological insights and diagnostic tools are vital for preventative measures. Such approaches include the prompt identification of at-risk persons and implementing interventions that mitigate the impact of the illness on the patients and their loved ones. Other options that have been mentioned by Westhoff are cognitive behavioral therapy, CBT, and the use of antipsychotic medications in the prevention of the condition transitioning to full-blown psychosis. The authors further states that there are new prevention strategies that are being investigated, including amino acid and cannabidiol administration, which demonstrates positive outcomes in small studies. Regarding age, the population that faces the highest risk of getting schizophrenia are individuals at the early adulthood or late adolescent stage of development, while in terms of sex, males have a slightly higher risk than women in developing the condition. Haney claims that race also plays a major factor, with people of African and Caribbean descent having a higher incidence of schizophrenia than whites. The investigators add that socioeconomic status is also an important component of developing schizophrenia, with those from destitute backgrounds having higher risk as well as those who reside in urban residents. Such populations have limited healthcare access and higher stress level. Identification of such population is important in the prevention of schizophrenia in the community. The impact of schizophrenia in society is mainly in the emergence of disability that prevents the functioning of an individual in society and the economic burden of addressing the condition. Thus, schizophrenia results in major societal and lifestyle impacts. For example, Strachnev describes that schizophrenia places significant limitation on persons, which is associated with reduced autonomy and quality of life, affecting a host of aspects that include daily functioning, relationship, and employment. People with the condition usually experience issues in sustaining stable jobs, developing meaningful relationships, and managing daily tasks. Such limitations increase disability levels, resulting in higher cost of care for society as a whole. Besides, the need for continuous care, support networks, and potential long-term care are also further worsens the economic burden.